Hello and welcome to this video in which we're going to be talking about trigger points. So you may have heard about trigger points but not really be sure what they are or why they might be important in relation to chronic pain conditions or even fascia and myofascial release. So let's start with a definition of what a trigger point is. It's a highly irritable, localized spot of exquisite tenderness in a nodule in a palpable taut band of muscle. So that was coined by Dr. Janet Travell, who was John F. Kennedy's personal physician in the 1960s. But equally importantly, she was the person who mapped and discovered trigger points and how they work in the body. So we owe a lot to her. So the description that she's given of trigger points is really good because it does sum up exactly what they are. So when you press a trigger point, it quite often feels tender and it can feel like a knot or a nodule in your muscle or in the soft tissues of your body. But what exactly are they and why do they form? So trigger points are areas of muscle and fascia that have become irritated, and that irritation creates micro scar tissue. So like a tiny bit of the muscle and the fascia that wraps around and through it becomes irritated, and then some scar tissue is created as a result of that. So because fascia is a very fluid tissue and it wraps around and through everything else in the body like a big three-dimensional network. So it means that if one part of your fascia creates scar tissue, then it's a bit like getting a snag in a jumper. So it changes the balance throughout your body, and over time it can start to create pain patterns. And the tricky thing about trigger points is that the pain that you feel is not always where the actual trigger point is. And this is called referred pain. And it's very typical with trigger points and with any kind of fascial problems. And this is also why a lot of people who have chronic pain have difficulty getting effective treatment. So as an example of a referred pain pattern, if you develop a trigger point in your neck, it can quite often lead to problems, pain, stiffness, tingling in your hand and your wrist. So if you only look to treat this area in your hand, you could be missing the actual root cause of the problem, which is in your neck. So working with trigger points, it's important to know where you are in the body and where the possible problem areas could be. But first of all, let's look at how trigger points form. So they can form through lots of different reasons, and some of the most common ones are surgery and scar tissue. So anytime you have any surgery, big or small, it creates scar tissue as your body repairs itself. And so this scar tissue over time can grow out from the original spot along local lines of tension in your body. And this can cause pain that can develop in a different area, maybe weeks, months, or even years after the original surgery. So another cause of trigger points can be accidents. So these could be big accidents, but for lots of us, it can be a combination of those small accidents that you hardly notice. So for example, things like tripping over a curb, bumping into something in the house, or maybe just slipping on a step. Any of those can create, again, some micro scarring, which can contribute to changing the balance and the tension in your body. Another cause of trigger points can be over and underuse. So overuse is where we're using one part of the body too much for repetitive movement. So a really good example of that is doing lots of computer work where you're using your hands a lot of the time on the keyboard and using the mouse. So over time, this can cause the tissues in your hands and your forearms to become irritated, and this can cause trigger points to form either in your hands and your arms or also into your neck. And that's because anything that involves overuse of one part of the body also involves underuse of another part. So again, with our example of computer work, if you sit and do a lot of computer work, the rest of your body has to brace itself into a position to hold you in that place. So in particular, your neck and shoulders become quite tight and tense to allow all this fine movement to happen with your fingers and your hands. So the trigger points can form in both places for different reasons, but everything is connected, obviously. Another cause of trigger points can be your posture. So we all have a natural posture, and very few of us have the benefit of being totally symmetrical. So whatever your posture is, it can contribute to tension, which can then lead to trigger points over time. And then finally, one of the common causes of trigger points can also be stress. So this can be the physical stress of doing work, doing movements, and it can also be emotional or mental stress, particularly where you're dealing with events that are outside of your control. But in reality, for most of us, it's some combination of some or all of these causes that actually cause trigger points to form and then start to cause problems for us. So how can we work with trigger points? So as I mentioned before, quite often trigger points cause referred pain patterns. So where you feel the pain is not necessarily where the problem area is. And it's a question of working out where those problem areas are. Once you've located a problem area, it will feel tender to your touch, and when you press it, it may just give you pain in that area, or it may actually recreate your pain pattern. And so to work on these areas, you can use your hands, you can use balls and other tools which help to release the tissues. And from a myofascial point of view, because all trigger points are involved with the fascia as well as the muscles, then the more slowly and the more progressively you work with the tissues, then the more effectively things will release. So for example, you can use a trigger point ball and you just need to lie on this, lean on it, sit on it, and allow time for the tissues to start to let go. So this can take a couple of minutes, and as you're there, you can feel a peak of pain that then eases off. And the more you work with your trigger points, the more they will start to undo, and eventually they will dissolve and just disappear. So working regularly with your trigger points can really give you benefits of reduced pain, better range of movement, and better balance in your body. So in order to help you find the trigger points that can be causing you pain, then you need to get a good self-help book like our trigger point book here. This has loads of very clear diagrams and easy to follow instructions which show you where the trigger points are that can be causing your pain patterns, and then how to work with them to release those trigger points. So if you want to find out more about trigger points and you want to get our book or our trigger point ball, then why not visit our website, where you can find these as well as lots more information about self-help myofascial release.